Hello, my fellow lupus warriors. Welcome to Heart about everything lupus, where we discuss everything about lupus. Today, we're talking about managing lupus. Lupus is a complex autoimmune condition with a wide variety of symptoms. It's systemic, so it means it can affect any part of your body. The cause remains unclear, and there is currently no cure. But some therapies can help to relieve symptoms, and lifestyle measures can improve a person's quality of life. Managing your lupus is very important if you want a better quality of life. So let's get into it. So get a cup of nice hot coffee or tea, put your earphones in, sit in a relaxing chair, and let the two of us discuss lupus. Managing lupus. Lupus is a complex autoimmune condition. There is no way to prevent lupus, but knowing what causes a flare can mean that the person with the condition can be better prepared when they occur. People should see a doctor if they often experience joint pain, stiffness, skin rashes, especially over the nose and cheeks, and fatigue. Weight loss, swollen glands, sensitivity to light, and perspiration in the fingers are also signs that may indicate lupus. Preventing a flare. Here are some things that may reduce the risk of a flare-up. Number 1, avoid sunlight. Sun protection is important for people with lupus, as UV exposure can trigger symptoms. Exposure to sunlight can lead to rashes and other symptoms in some people with lupus, including fatigue and joint pain. According to research published in 2014, photosensitivity is a common factor in cutaneous lupus erythematosus, skin lupus, and the ACR includes it and its diagnostic criteria for lupus. People with lupus should use a high-factor sunscreen of 50 plus that protects from both UVA and UVB rays and wear clothes to cover the body. Number 2, avoid some medications. A number of prescription drugs can trigger symptoms, including the sleep aid melatonin. This is recently known. Antibiotics like Bactrim and Flagyl, very important. Any drugs containing sulfur, penicillin, hydralazine, and procinamide. And individuals should always check with their doctor if any new medications are likely to cause a problem. Avoid certain foods. For a person with an autoimmune condition, enhancing the immune system can be a problem. Foods such as garlic, alfalfa sprouts, and supplements such as Agnese may have this property. Any supplement, medicine, herbal supplement, and alternative therapies that boost the immune system can boost the lupus and cause a flare. So avoid these at all times. Number 4, avoid toxins. Researchers have found that cigarette smoke, alcohol, and some work-related and other chemicals like silica, pesticides, mercury, etc., appear to trigger genetic changes that can lead to lupus. People should avoid these as far as possible if you are likely to develop lupus and if you have lupus. Treatment. Once a person has a diagnosis of lupus, the doctor or rheumatologist will develop a treatment plan based on the severity and the location of their symptoms, as well as their age, sex, health, and lifestyle. The plan may change over time as the condition develops. In developing a treatment plan, the doctor will aim to prevent flares, treat symptoms when flares occur, reduce the risk of complications such as organ damage and other problems. The types of medication. This month in our tips, we will be covering medications to treat lupus, so don't miss it. The treatment team. Lupus is a complex condition. A team of specialists may provide treatment. At first, the person will probably see their family physician, GP. The physician may then refer them to a rheumatologist. But the team of professionals that treat lupus may include Clinical immunologists, we don't have much of them in South Africa. I think long ago I only found one. Nephrologists that treat kidney disease, hematologists treat blood disorders, dermatologists treat skin conditions, neurologists treat problems relating to the nerve system, cardiologists treats the heart, endocrinologists treat problems related to glands and hormones, mental health specialists, as lupus can lead to both depression and a reduction in cognitive function in severe cases. Dietitians, social workers, and other therapists may also be part of the team. A physical therapist, physical medicine and rehabilitation for lupus may involve physical therapy, occupational therapy, speech therapy, recreational therapy, and a combination of these options, complementary and alternative therapies. No research to date has confirmed that specific alternative and complementary therapies can prevent organ damage. That's why you can never stop your lupus medication. It protects your organs. Most doctors and lupus organizations recommend special diets. We have a lifestyle video on our YouTube channel. The link of our YouTube is in the description of this post, so go have a look. The only supplements we suggest is calcium, magnesium, folic acid, and zinc, not vitamin B and C. You must include that in your diets. Why? Vitamin C and B boosts the immune system. So don't take them as supplements. Ointments and creams, chiropractic treatment, vitamin D, omega-3 fatty acids, turmeric, which is a strong anti-inflammatory, cognitive behavioral therapy, which is talk therapy that will improve your mental health. Living with lupus. Lifestyle approaches may help a person to cope with the symptoms or reduce some of the stress associated with living with a chronic illness. Examples include yoga, tai chi, meditation, and other relaxation therapies. Keeping physically active as far as possible, for example, through swimming or walking, setting priorities for work and ensuring enough rest time, using a 50 plus factor sunscreen that blocks both UVA and UVB rays, covering up the body with clothing. Following a healthful, balanced diet with low salt, gluten-free, lactose-free, and sugar-free, applying heat to painful joints or taking a warm bath, avoid smoking as this may trigger symptoms or make them worse, and keep to all medical appointments and following doctor's instructions. Frequently asked questions. What should a person with lupus avoid? A person with lupus should avoid smoking, becoming overtired, an unplanned pregnancy. It is important to adjust your lupus medication at least 6 months before falling pregnant to avoid harming a fetus. Stress, sun exposure without sunscreen. Those are the six things we suggest you avoid. What is the life expectancy of a person with lupus? With treatment and regular follow-ups, 60 to 70% of people with lupus have lifespan similar to those without the condition. Around 30 to 40% of people with lupus will die prematurely due to complications of the condition. So you must avoid this at all costs. Takeaway. In the past, lupus was often deadly, but current treatment can relieve symptoms and delay the start of complication, increasing the chance of a normal lifespan. ACR and EULARS, that is American College of Rheumatology and Europe's Organization for Rheumatology, their new way of diagnosing lupus will mean that treatment can start earlier in the process, increasing the chances of reducing the long-term impact. We have a video with how lupus is diagnosed on our YouTube channel. Patients may find it helpful to join one of our support groups. Just inbox us and we'll add you to one. A doctor may also be able to advise any clinical trials that are available. There are a few on our socials at the moment. Trials can give access to new and experimental medications, for people who would like to try them. If you do as much as you can to manage your lupus, it will definitely improve your quality of life. This concludes this podcast. Please review it on the platform you are listening on. Leave a comment below on topics you would like us to talk about. If you enjoyed this podcast, please hit the like button below, follow us on Facebook, Instagram, and TikTok, and subscribe to our YouTube channel. Andrea's Gift, Twins and Teen, Lupus South Africa, Susie Eagles Flight. Thank you for listening, and remember, giving up is not an option. Bye.